Fatty liver. Is fatty liver dangerous? Whether fatty liver is dangerous no longer depends on the degree of pathology. Basically, this is a benign disease. If the patient is having a level 1 disease, there is no need to worry too much. Patients only need to change their diet, practice sports to improve their condition. The disease passes into stage 2 or 3, the degree of danger will increase. The patient needs to see a doctor for a thorough examination, receive the treatment that the doctor advises. Fatty liver disease left for as long as possible causes more difficulties in treatment. In particular, fatty liver can cause complications such as hepatitis, cirrhosis, affecting the cardiovascular system, disorders of other organs, especially liver cancer. What is fatty liver? Fatty liver is a condition in which the liver contains large amounts of excess fat that accumulate in the organ system. Healthy people, with normal physical condition, fat only accounts for about 2% to 4% of liver weight. Particularly for patients, fat will account for at least 5% to 10% of liver weight. Although this is a benign disease, if not treated early, it can be dangerous to health. If left untreated, fatty liver can lead to the risk of diseases such as cirrhosis, liver cancer. Causes of fatty liver. The most common cause of fatty liver is alcohol. But in many cases, there are still patients with fatty liver who do not belong to the group of heavy alcohol use. When the body takes in too much fat or metabolizes fat in time, the excess fat will store in the liver cells and cause fatty liver. However, a high-fat diet is not necessarily the cause of this condition. In addition, people experiencing the following health conditions are also at higher risk: overweight, obesity, high blood cholesterol levels, people with hepatitis, type 2 diabetes, polycystic ovary syndrome, sleep apnea, impaired thyroid function, hypothyroidism, impaired pituitary function, hypopituitarism, elderly. There are some other common causes such as genetics, rapid weight loss or side effects of certain drugs such as aspirin, steroids, tamoxifen or tetracycline. Early signs and symptoms of fatty liver disease. Tired. Fatigue is a symptom that can be associated with a variety of pathologies. You may also feel tired, weak, poor concentration, loss of energy, and cognitive impairment in fatty liver disease. It is important to pay attention to other symptoms that accompany fatigue in order to detect fatty liver disease early. Obesity. Obesity is the biggest risk factor for fatty liver disease, with research showing that obesity increases the risk of fatty liver by up to 75%. Eating healthy and exercising regularly is a good way to reduce overweight or obesity, helping to reduce the risk of fatty liver disease. Itch. Fatty liver disease can lead to itchy skin, including on the face. Itching is mainly caused by an excess of bile salts in the body. Scratching usually doesn't help relieve itching caused by fatty liver and can make irritation worse. Binge eating. Suddenly eating more than usual can be a sign of liver disease. You will feel hungry throughout the day and you will often snack when you crave sugar. This promotes the formation of fatty liver disease and worsens the disease. High blood cholesterol levels. High cholesterol levels indicate a higher risk of heart disease, but are also a sign of fatty liver. It is important that you cut cholesterol-rich foods from your daily diet. Jaundice. Advanced liver disease can lead to jaundice. This condition causes the skin and whites of the eyes to appear yellow. Symptoms of jaundice usually appear in the eyes and face before spreading to the rest of the body. Jaundice occurs when there is too much bilirubin, a yellow-orange pigment that is a byproduct of the breakdown of red blood cells. If the liver doesn't work well enough, too much bilirubin builds up and causes the skin to yellow. Treatment of fatty liver. There is no specific treatment for fatty liver disease, but liver fat, inflammation, and early liver damage can be reversed by the liver's self-repairing body. The most effective treatment is lifestyle changes to manage factors that contribute to fatty liver. For alcoholic fatty liver disease, the most important thing is to stop drinking. For non-alcoholic fatty liver disease, depending on the medical condition of each person, the doctor will give appropriate advice. For example, losing weight if you are overweight or obese, changing your diet, increasing exercise, taking medications to control diabetes, dyslipidemia, hypertension. If fatty liver progresses, causing complications, treatment will include treating these conditions with medication or surgery. If cirrhosis causes severe liver failure, a liver transplant may be needed. Methods of curing fatty liver using Western medicine. Fatty liver is a common pathology in many people, which can cause many dangerous complications such as hepatitis, cirrhosis, liver cancer. For the treatment of this disease, there are various methods, among which Western medicine is one of the popular options. Western methods of treating fatty liver often use drugs containing active substances such as arginine, is an amino acid that helps create urea in the liver, regulates ammonia levels in the blood, promotes proteid combination. Choline, is a substance found in phosphatidylcholine that helps dissolve fat in the liver, reduce cholesterol in the liver and limit the degree of liver damage caused by lack of active ingredient choline. Methionine, is a substance that provides methyl to create choline, protecting the liver against fat accumulation. Methionine also has the ability to detoxify, restore, and enhance liver function. However, Western medicine methods also have disadvantages such as side effects, affecting liver and kidney function, high cost, and must use the right dosage. Therefore, patients need to consult a doctor before using and combine with other methods such as Oriental medicine, folk or diet, healthy lifestyle for best results. Methods of curing fatty liver with Oriental medicine. Fatty liver is a common pathology in many people, which can cause many dangerous complications such as hepatitis, cirrhosis, liver cancer. For the treatment of this disease, there are various methods, among which the method of Oriental medicine is one of the safe and effective options. Oriental medicine methods of treating fatty liver often use herbs that work. Low balled apples help reduce fat in the liver, support fat metabolism, protect the liver from damage. Meridian activation helps blood circulation, eliminates toxins, sputum, reduces inflammation, prevents cirrhosis. Some popular Chinese remedies for fatty liver are ginseng ling, includes medicinal herbs such as ginseng, reishi, baiko, contemporary, white dahlia, licorice, isoginseng, white spirit, chindermis, mercy, posthumous, semi-inferior, white spirit. The remedy has the effect of lowering the effect of bald, suing the qi. 2 sealing scales of dispersion, including medicinal herbs such as star licorice, chindermis, mercantile, posthumous, semi-inferior, white spirit. The remedy has an active blood, meridian, and expectorant effect. Cat flower ladder, including medicinal herbs such as cat flower, rhubarb, rhododendron, contemporary, white dahlia, licorice, white spirit, chindermis, merchant, hao fa, semi-inferior, white spirit. The remedy has the effect of detoxifying, protecting, expectorant, meridian. Complications of fatty liver. Hepatitis. The liver is inflamed, damaged. Fibrosis. Scar tissue forms where the liver is damaged. Cirrhosis. Enlarged scar tissue, which replaces healthy tissue, slows down the functioning of the liver. Liver failure, liver function deteriorates, difficult to recover. Liver cancer. Liver cancer is the most advanced stage of liver disease. It is also the most common type of cancer in Vietnam. Other complications of fatty liver: cardiovascular disease, type 2 diabetes mellitus, metabolic syndrome. How to prevent fatty liver? Eat plenty of fruits, green vegetables, whole grains, limit salt, sugar and saturated fat. Exercise regularly. Keep a healthy weight. Drink alcohol in moderation. Get vaccinated, especially the hepatitis A and hepatitis B vaccines. Hepatitis C does not have a vaccine, so you should take measures to prevent infection and get tested periodically. Care should be taken when using functional foods, medicines and herbs of unknown origin. When using the drug, it is recommended to take it strictly as prescribed by the doctor. Good management of underlying diseases such as diabetes, hypertension, dyslipidemia. For the treatment of fatty liver takes a lot of time and combines several methods. In addition to changing your diet, living healthily, you can use remedies from nature. Many patients have applied and succeeded by this method because it is easy to implement, simple, benign, that can bring good results beyond expectations. Apple cider vinegar removes fat deposits in the liver. Apple cider vinegar is fermented water from crushed apples. There are many uses from this water that can be mentioned as weight loss, osteoporosis, stomach pain, sore throat, high blood pressure, expectorant, anti-infectious, cholesterol lowering, slowing down the aging process. Besides, apple cider vinegar also helps remove fat accumulated in the liver, enhances liver function, thereby having the ability to cure fatty liver. Lemon relieves hepatitis that is associated with fatty liver. Lemons contain the compound naringenin, which is believed to reduce inflammation of the liver associated with fatty liver. Vitamin C and the antioxidants abundant in this fruit also help enzymes produce glutathione. Neutralize toxins and detoxify the liver effectively. Turmeric helps regenerate liver function and eliminate excess fat. Turmeric contains curcumin essence that has the ability to prevent, restore liver damage, regenerate liver function and eliminate excess fat, thereby improving fatty liver condition. Turmeric supplements help prevent high blood cholesterol levels and reduce the risk of fatty liver disease by regulating enzymes responsible for cholesterol metabolism. Amniotic leaves reduce the accumulation of excess fat in the liver. Amniotic leaves are familiar plants in every Vietnamese family. They have many good effects for health such as diuretic, gout prevention, diabetes treatment. Research shows that in water, amniotic leaf tea contains active ingredients tannin and vitamins that support liver detoxification, reducing the accumulation of excess fat in the liver. Therefore, using amniotic leaves to treat fatty liver brings effective results. Treatment of fatty liver disease from pomelo peel. Grapefruit is a familiar fruit, which stands out for its weight loss uses. According to Oriental medicine, pomelo peel has a bitter taste. Non-toxicity. One of the great effects of pomelo peel is to help reduce blood cholesterol, lower blood fat, reduce fatty liver. Pomelo peel also contains a large amount of essential oils and 2.5% to 3.2% of the flavonoid neohesperidin, which helps with good antioxidants. The flavonoids in pomelo peel also help protect liver cells, choleretic, and help strengthen the vascular wall. Has a very good effect for people with fatty liver. In addition to applying the natural fatty liver treatments mentioned above, you also need to note some more things below. Choosing to use natural methods brings results if your condition is still mild, without complications. Consult your doctor. before choosing to use natural foods. If you are using Western medicines, plan regular health checkups to better monitor your condition.